Hello there, my name is Oran, and I'm a British acupuncturist living in Taiwan. I first qualified in TCM in 1987, and after about 10 years, I retrained with Stephen Birch and Junko Ida into Japanese methods, including Manica system acupuncture and Toyohari, which is a 5-element meridian therapy approach. I'm also the originator of the Ontake Method, which is what I'm going to talk to you about during this video. So let's introduce Ontake with a short video so you can see it and see exactly what it does. First of all, you get a piece of bamboo and you stuff it full of medium-grade Japanese moxa, and you compress the moxa into a plug so it doesn't fall out. You can use a little piece of wood to flatten the end, and then you set fire to it. And the bamboo becomes warm, and you can apply it anywhere on the body, including the face, including the head, and it's safe and simple to apply. So let me summarize that for you. It's a piece of heated bamboo, and it's like a moxa box, but it's more mobile, and it's very agile, and it's very rhythmic, and it's very safe and simple to apply. So where does it come from? You might think that Ontake is some ancient piece of equipment handed down to us from antiquity, but actually it's not. The first time it's mentioned is in a book by Makoto Yamashita, and he says there's this new moxibustion tool. You can light it and apply it locally where there's stagnation of qi and blood. So essentially, if there's pain in the shoulder, you apply it to the shoulder and it moves qi and blood locally. So it was a local branch tool. It's possible, we don't know, but we think he might have been using it as early as the 1960s. So you can see it's very much like the new kid on the block. It's not been around for a long time. I came across it in 2009 and I started writing about it about a year later, 2010-11. And the son of Izaburo Fukaya, who was a very famous 20th century moxibustion practitioner, is called Hideo Shinma, and he wrote about it in Japanese in 2012. So you can see it's really a very new kind of tool. And because of that, that means that there's no orthodoxy attached to it. And we are limited only by its physical characteristics and by our imagination. Well, let's take a closer look. So a piece of bamboo is basically about 5 centimeters in height, the way Yamashita first described it. And it's about external diameter is about 3 centimeters, 3.5 centimeters. And the thickness of the skin is 3 to 4 millimeters. So the thinner the skin, then the hotter it gets. And the thicker the skin, then the cooler it feels, both to you as a practitioner holding it and to your patient. Well, as you can see, the lip of the bamboo is rounded, and that means that you can apply the bamboo not just with the side of the bamboo here, but also with the rounded lip. You can press with that, and also you can apply it with the lighted mouth. So it's a very versatile tool, and it can be used in any vector in any way. So we've introduced Ontake. It was a simple moxibustion device that originally was used as a branch treatment. So if someone has knee pain, you apply it to the knee. If someone has shoulder pain, you apply it to the shoulder. What I'm going to talk about now is the integration of various theoretical models which make this very simple moxibustion tool a very sophisticated addition to your clinical repertoire. So let me define the Ontake method. It's a bodywork method integrating different theoretical models. And these theoretical models include Dr. Manica's meridian frequencies, deficiency excess, and holographic mappings. But one thing I'd like to say to you is that sometimes when you go on acupuncture courses, you learn something that completely revolutionizes how you work. So, for example, I learned Manica system acupuncture, and that changed the way I work, and I moved away from TCM as a result. But Ontake is not like that, because it's not like a cuckoo that pushes out everything you already know. It's something that adds on to what you already do. So I integrate Ontake into my workflow with my Manica system acupuncture or with my Toyohari. It doesn't mean that I don't do those things anymore. It's just that I have this additional tool that fits into my workflow. So let me talk about Dr. Manica and Dr. Manica's meridian frequencies, and also about Dr. Manica's wooden needle and hammer. Dr. Manica was widely regarded as the 20th century master acupuncturist and medical doctor. He was extremely effective in clinic. So he was a medical doctor, he was fascinated by traditional healing methods, and he was very research oriented, and he really had a scientific approach to proving or disproving some of the assumptions that we make in traditional East Asian medicine. One of the things that he developed was what we call now Dr. Manica's wooden needle and hammer. He developed a number of non-invasive treatments. And the wooden needle and hammer was based on a 16th century style of acupuncture called the Mubun Ryu school, where they used a blunt golden probe and they palpated the belly, and where they found indurations on the belly, then they would tap it with this wooden mallet. So the wooden needle and hammer is based directly on that design, and he got into tapping acupuncture points and acupuncture meridians with his wooden needle and hammer. But most interestingly, he also developed frequencies of beats per minute, which he used to tap the points. In other words, he researched frequencies of beats per minute that affected specific meridians. And we call these things Dr. Manica's meridian frequencies. And if you're interested, just freeze frame this and screenshot the video. So you can see that these are the frequencies of beats per minute that different meridians respond to. And you can just get a metronome online and set the metronome to one of these frequencies, and then you can tap or roll or press or apply acupuncture according to those frequencies. Now, in the next video, I'm working with a young lady from South America, and she has neck pain. And I'm using one of Dr. Manica's tricks. I'm tapping at Du 14, which is the meeting of the yang channels. And I'm tapping at two different frequencies, the frequency of Bada channel and the frequency of Gallbladder channel, where she has pain. Then, look to the right. How does that feel?
Better.
And the other one? So let's go for that. There. Oh, okay. Then we change the frequency again. Ready? Try again. Look right.
And this was better than what was next one.
That's it. We're So I was very taken with the effectiveness of Dr. Manica's wooden needle and hammer, particularly when used with his meridian frequencies. And what Ontake does is it combines the mechanical, percussive, and frequency components of Dr. Manica's wooden needle and hammer with the warming, supplementing, and blood-moving effects of moxibustion. I mentioned earlier that I had studied Toyohari, and the Toyohari Association is essentially a meridian therapy 5-element organization set up for blind practitioners So most of my teachers in Japan are blind or partially sighted. And fortunately, they don't limit their teaching to people with visual impairments or indeed to Japanese nationals. So foreigners can go and study with them. Now, if you are blind or visually impaired, then palpation is going to be supremely important. And apart from palpating the hara and apart from taking the pulse, the practitioners in the Toyohari Association are also checking the channels, the meridians themselves, and they're palpating them for deficiency excess. So deficiency excess translates as kyo and jitsu. And you can easy to remember because kyo is the short deficient word and jitsu is the longer word. So kyo and jitsu. And first of all, of course, when we palpate, we look for normal tissue. And tissue should feel warm and alive and have good luster, like a good feeling to it. But we're also looking for abnormal tissue findings. This is what we do in all kinds of palpation. When we look for acupuncture points, we look for something hollow or empty, or we look for something hard and indurated. So we're always looking for abnormal tissue findings. We can summarize this in the following way. Jitsu is where something exists, and kyo is where something does not exist. So if you imagine a balloon which is filled up with air, then something exists in the balloon, and when you feel it, it feels hard and swollen and tight. Whereas if you let most of the air out, then something does not exist, so the balloon feels kind of flabby and soft and soggy. So on the body, when we're palpating, where the tissue is soft and collapsed or hollow or like a trough, then that's kyo. And where it feels swollen and hard and tight, then that's jitsu. And you can think very easily about kyo and jitsu. The most obvious sign is temperature, because where there are temperature changes on the body, then you can see there's an imbalance of of qi and blood. So I'm sure we've all stroked somebody's back. We've noticed that it feels warm in the upper part, and then you go down to the lower part on the lumbar area and it feels very cold. So that is an abnormal tissue finding that you need to rectify. So here's a list of kyo and jitsu signs. Again, you can screenshot this if you like. Kyo is a kind of depressed, soft, weak, cold, rough feeling. And jitsu is a raised, elevated, hard, swollen, tight, stiff feeling. And particularly in the video that we'll look at, we'll see there's a reflection between kyo areas and jitsu areas. So I'd now like to introduce you to the 3 golden rules of the Ontake Method. Please write these down. These are palpation, palpation, palpation. Now, that's not just being flippant, because we palpate before we treat, we palpate as we're treating, and we palpate when we finish treating to make sure that things have changed in the way that we want. So it's really important to keep palpating all the way through your treatment. And what we do with Ontake is where we find kyo signs, we supplement and we apply bamboo in a supplementing way. And where we find jitsu signs, then we disperse. We do more percussive treatment. And simply put, then when we do warming treatment with the Ontake, it's more supplementing if it's more warming. And when we tap percussively, mimicking Dr. Manika's wooden needle and hammer, then that's more dispersing. So as a rule of thumb, every technique has a warming component and a dispersing percussive component, and the way you apply the techniques should be suited to the territory, to the kyo and jitsu of the tissue that you're treating. And this is the bottom line, is by regulating kyo and jitsu in the channels, we regulate the whole. So originally, Ontake was used as a local branch tool. You just apply warmth and you roll where it feels stiff or tight and it feels kind of better. But now what I'm saying is that by regulating kyo and jitsu in a particular channel, we can have whole body effects. So let's take a look at that in the following video. So I'm going to start on with just some general palpation. And what I'm doing is stroking. And I'm looking for roughness and moistness. Basically, we're stroking the yang channels. And once I've done some stroking, I can just do a little bit of slightly deeper palpation and see if there's any area of tightness. And right away, I can find some tightness in here. Can you feel that? Yeah. And some hollowness here. By hollowness, when I go along the large intestine, you can actually see it.
Yeah.
You see how the large intestine channel is like a little trough. Can you see that?
Mm-hmm.
I've noticed that there's a real correlation between, if you put this as, imagine this is a mirror, and gets jitsu, and when this is jitsu, there's going to be some kyo things over here. And then when you bring the elbow up here, then that kyo is level with that jitsu. It's just a very frequent finding. So, see, there's an indentation from Janet's watch.
Yeah.
So you can see there's some sponginess there. So that's deficient. That's in terms of temperature, there's a slight coolness around here.
I can feel the difference in your hand temperature.
Yeah.
Much here, right, cold.
Yeah. So then there's she's got a cold sleeve around here. So there's not an even distribution of temperature. So go ahead and feel that. And what I can feel here is just these cold feet. Cold feet, touch shoulders, go together. Yeah. Very, very frequent. If you find that people have got cold feet, you can say, do you get tight shoulders? Do you get headaches? Do you get hot flushes? Is it hard to sleep at night?
I mean, everything you were saying that
Right. So deficiency below and excess above. So Janet's a case in point. And what I'm expecting to happen is that this tightness here, it's already got softer, is going to improve. So let's start off with, I'll turn that down a bit. We had it quite loud for your teaching, but in actual fact, and I'm just going to tap on this deficient area. I'm not worrying about direction. How's that from the...
Yeah, it's not too touch.
All right. Okay, can you guys who felt that just kind of feel the change there? Because it was that quick. So I'll just carry on with that. I'll just do a little bit of tapping along the large intestine channel. Now here, I could do a little bit of rolling. But when you find excess, work on deficiency first. So here's pressing with the lip. And Janet is having her first Ontake moment. You're feeling, it feels nice, isn't it? Yeah. Okay, then I'll go to triple bounder. So let me summarize the story so far. Ontake is a 1960s moxibustion tool that was used locally to move local stagnation of qi blood. However, it can be applied holistically with theoretical models such as Dr. Manika's meridian frequencies or Kyoan Jitsu. Now I'm going to introduce another theoretical model, and these are holographic mappings. Now, the idea of holographic mappings is that every small part of the whole contains all the information of the whole. And we can see that because a zygote contains all the information required to make you or me. And so holographic mappings are a way to treat the whole from a part of the whole. Now, the most holographic mapping of all is probably foot reflexology. And in foot reflexology, we say that when we treat the big toes, we treat in the area of the head and the brain. And when we treat in the upper part of the soul, then we treat in the upper part of the torso. The middle part is the middle jiao. And when we treat in the heel, then those are the organs of elimination and urinary tract, etc. And if we put the 2 feet together, we can see that the medial surfaces relate to the spine. So I'm going to talk about 2 kinds of mapping. One of them comes from Dr. Richard Tan, and he used concepts called mirroring and image mappings. And also I'm going to talk about Kurakichi Hirata, who was a Japanese pioneer who invented or developed these horizontal zonal mappings called the Hirata zones. So let's start off with Dr. Tan's mirrors. And essentially, he said that the limbs are mirrors of each other. So it's very obvious that the upper limb is the right arm and the left arm are mirror images of each other. And the idea is that if I treat my left shoulder, I can also affect my right shoulder. If I needle the upper arm, I affect the upper arm on the other side. And we can flip this to upper limb and lower limb. So if I needle the hip, I affect the shoulder. If I needle the knee, I affect the elbow. If I needle the ankle, I affect the wrist joint, and vice versa. So if I needle the wrist, I affect the ankle, etc. So if I'm applying Ontake to this area here on the upper arm, I'm also treating this area here between the 2 joints. And if I'm applying Ontake to this area here, then I'm treating this area here. So that's the idea of the mirrors. But we can also map out the torso onto the limbs. And here in this mapping, you see that if I treat the top of the shoulder, it affects the top of the head. If I treat the shoulder joint itself, it's at the level of the atlas joint here. And if I treat the elbow, it's at the level of the umbilicus and also L2. And if I treat the fingers, it's at the level of the genitals. And you can see that on the back as well. So top of the head, top of the shoulder, top of the hip, both treat the top of the head. And here, the knee and the elbow correspond to L2, and the wrist joint corresponding to L5S1, and the hand corresponding to the sacrum, the foot also corresponding to the sacrum. So I can apply Ontake anywhere along the arm to affect anywhere along the torso. So in this diagram, Dr. Tan is mapping the entire torso onto either the upper limb or the lower limb. But in this diagram, he's mapping the head and face onto the lower limb or the upper limb. So you can see if I apply Ontake to the shoulder, I affect the top of the head. If I apply Ontake to the upper arm, it affects the forehead. If I apply Ontake to the elbow or to the knee, it affects the TMJ, the ear and the eye, etc., all the way down to the fingers and the bottom of the chin. Now, these ideas are incredibly useful for the treatment of pain, and I use Ontake all the time with these models for the rapid relief of pain. Not so much for internal medicine, and for internal medicine, I turn to Hirata zones. So let me introduce them a little bit. Kurakichi Hirata was another 20th century Japanese innovator. He died in the Second World War in 1945, and he had developed horizontal, what he called dermatome mappings, or horizontal zones on the body. And these horizontal zones correspond to the organs. So there's a bronchi, a lung, a heart and a liver and a gallbladder, a spleen, a stomach zone, etc., going all the way down the arm. And also going all the way up the leg in the opposite order. So the leg region, the arm region, and also in different regions. So also the head, also the neck, the face, the torso, and the arms and the legs. And his idea was that these zones correspond directly to the organ. So when there are problems in the organs, you can detect reactions or abnormal tissue findings on these zones in different regions. So if there's a problem with my liver, then the liver zone will show up in different regions. If there's a problem with the kidney, then the kidney zone will show up in different regions. This is really interesting because we say that when people are kidney deficient, then they get dark under the eyes and they get knee pain and they get lumbar pain. And these all happen to be the kidney zone in Hirata therapy. So Hirata zone therapy ties together these disparate symptoms of kidney disease. I like to use the Hirata zones in internal medicine. So if I'm treating a patient who has some kind of spleen deficiency, then I can apply Ontake to the spleen zone in different regions. Or if a patient has kidney deficiency, I can apply it to the kidney zone in different regions. Or I can give them an Ontake and tell them to apply it daily on the kidney zone. So that accelerates the treatment. So I tend to use the Dr. Tan's mappings more for pain relief and Hirata zones more for self-help, helping patients to treat themselves or their family, and also to accelerate my treatments in the direction that I want to go. So let's look at a case now using Dr. Tan's mapping for the face. So this is a patient who has intense jaw pain leading to headache and neck pain.
音が鳴ってる感じ。
Is that tender, no?
押さえて痛いですね。
Yeah, there.
painful.
Another one? No. Here. Yeah. Two. Okay. So swallow testing. Triple burner. So triple burner is a little bit painful. Just at this point here.
耳の前の、反射系の痛みのようですね。
Tan core vibe is a little bit painful.
半径も、
And stomach is very painful.
胃系もですね。
I think stomach is more painful than anything.
胃系が、おそらく痛み、一番反応があったみたい。
Is that painful? Yeah. Start pairs to large intestine.
胃系の、距離感、大腸気がペン今。
Now, I've shown you one of Dr. Tan's mappings, which I use most commonly. But Dr. Tan also says that you can map this part onto the arm.
こう、また、ほぼ似たような考え方になるんですが、顔ですね。頭のてっぺんから顎の、下まで。この、エリアがそのまま腕に対応するというふうにも考えます。
In that case, the hinge here is the elbow.
ヒンジになっているところが、顎ですね。が、肘に対応します。
So I'm going to start with that mapping.
このマッピングを使ってまずは成立していくと。
Just because the jaw doesn't quite fit into what we were talking about.
特に顔の中でも顎みたいなところはさっきのモデルだ。
Are you getting pain all the way around here now? You are.
目の上から。
Let's start off with the jaw and this mapping. Then we'll see if we can do top of the head. Something else.
まずは顎の痛みに注目して、その後、目の上の痛みも見ていきます。
So opposite side.
逆後ろ説明。
The large intestine channel.
大腸系。
And using the hologram, just the isophasal relationship between hinge joint here and hinge joint here.
What's happening? 今です。テストしてもらっていいです。
楽になってきる。
できない。
What?
Oh, it's
That?
Yeah.
You're not painful anymore.
Yeah.
Look at that going.
さっきまではあったんです。
It's good. It's
Oh, that.
good.
Yeah.
What you did right now.
What's happening to all of this?
Nothing.
Nothing.
Nothing. Yeah.
Well, I hope you found that interesting. So let me finish with some concluding remarks about Ontake. So far, we've talked about it as a add-on thing that you put at the end of your sequence, but it can actually be used on its own as well. It can be used as a root treatment. So by working, for example, on the yang ming channels on the large intestine and stomach and on the back shu points, you can actually apply it as a root treatment, a standalone root treatment in its own right. And this can be used to stimulate a healing response in patients who are very difficult to treat, or where you're not really sure of what's going on, or where your acupuncture treatments have plateaued. Then you can apply it in this way. We've seen that originally it was used as a branch treatment, and it was used on the shoulder, but can be used in a number of other ways for branch treatments to treat symptoms. So, for example, for sinusitis, for headache, for tinnitus, for eye problems, for diarrhea, for anxiety. So it can be used as a branch treatment in all kinds of ways, and you just add it into your workflow, into your sequence of treatment. We've just seen in the video how effective it can be for pain relief, for the rapid relief of pain. And I think this is one of its most spectacular uses, that you can treat people who are in pain and just within a couple of minutes, the pain is hugely different. And I use Dr. Tan's mappings for pain relief. And as an adjunctive treatment, I use the Hirata zones. So if someone's kidney deficient, then I'll use the kidney zones. If someone's spleen deficient, I'll use the spleen zones. And I can even give them an Ontake to take home as a home treatment. So it can be very useful in that way. So I hope you found this useful. I am imagining that there are going to be a list of resources and some links below, so you'll be able to access my teaching calendar and also some books that I've written about Ontake. And incidentally, those books are being translated into Spanish and Portuguese as we speak, and hopefully will be out at the end of the year. So thank you very much for watching. Thank you very much for listening, and I wish you happy tapping.